let's start. Basically, the human face, I think, we can all agree that each human face is quite unique, an extremely important aspect of each person's identity. On one hand, the disease is not a life-threatening disease. Facial paralysis or Bell's palsy is not a life-threatening disease. However, we can all agree that the face is perhaps the most important region in the body. We socially interact and express our feelings and emotions with the facial muscles. So therefore, developing alternative medical treatment options for these patients is quite important. So what are the differences between central and peripheral type of paralysis? The answer to this question starts from basic understanding of the anatomy of the facial nerve. So the facial nerve is one of the longest cranial nerves. It emerges from the brainstem in the pons and extending to the terminal branches, which are located in the face. So lesions which are located in the upper motor neuron part are causing central type facial paralysis, and they manifest a bit differently. Usually the central type paralysis only affects the lower part of the facial muscles. However, peripheral type of facial paralysis, the lesions are located in the lower motor neuron area all along the pathway of the facial nerve. Causes of facial paralysis are quite varied. As you can see, there are many different factors that can cause facial paralysis. One of them is tumors, different type of tumors along the lower motor pathway, either benign or malignant tumors. The majority of these patients who suffered from tumors, they will develop facial paralysis after the resection of these tumors. Another cause of facial paralysis is iatrogenic factors, like, for example, TMJ surgery. Viruses are also play an important role of the development of facial paralysis. Varicocele zoster virus, VZV, or what's known as Ramsay-Hunt syndrome, can cause facial paralysis with or without shingles. Usually the shingles are beneath the ear. This type of facial palsy is considered to be more difficult to treat, and definitely viruses are main etiology causing facial paralysis. Also, viral otitis media or any type of ear diseases can cause facial paralysis. Trauma also play a role in the development of this palsy, and more specifically, temporal bone fractures caused by any type of fractures associated with motor vehicle accidents or any kind of trauma. Stroke, either hemorrhagic or ischemic, can lead to central type facial paralysis. Okay, so upper motor neuron lesions in the brain area. And last, after we exclude all of those reasons, so basically Bell's palsy, the method of diagnosis is excluding all these factors. We have the term idiopathic form of facial paralysis, which is known to be called Bell's palsy. Okay, so Bell's palsy is the most common cause of unilateral peripheral facial paralysis. Both sides of the face and both genders are equally affected, and the paralysis may happen at any age, but the median age is about 40 years old. The incidence is quite varied according to different populations. The numbers are usually between 11 to 53 cases per each 100,000 people. Actually, in Chinese medicine point of view, it's quite interesting because we can see that in Scandinavian countries, for example, The incidence is higher in China and in Asia, where we have cold climate and damp climate. These paralysis are more common. So in Chinese medicine, this type of disease is categorized by the invasion of external pathogen, okay, part of the 6 qi, the Liu qi. Okay, so usually it's a combination of wind cold. And in Chinese point of view, Chinese medicine point of view, this reason why the incidence varies between population can explain very well. In terms of the etiology of Bell's palsy, so up until today, there is a debate, what is the etiology of Bell's palsy? But viral infection, herpes simplex virus type 1, again, a virus etiology, is considered to be the leading cause for paralysis. So basically, we have inflammation in and edema in the bony fallopian canal in this region. Usually, it's reactivation of HCV type 1, okay, which will cause inflammation and nerve compression in this area, which will eventually lead to either temporary or permanent nerve damage. In terms of signs and symptoms of the disease, we'll see signs of dropping eyelid or dry or excessive tears due to the inability to close the eye. We'll see facial paralysis and twitching or weakness in the facial muscles, and usually the majority of the patients will have a dropping corner of the mouth. In terms of symptoms, the patient will complain of weak facial muscles, impaired taste or dry mouth, and especially in the acute condition, they will complain about posterior auricular pain, okay? In terms of the course and the prognosis of the paralysis, so overall the prognosis of Bell's palsy is quite favorable. This study is coming from Scandinavian country. It was published in 2002, and they follow a spontaneous recovery of 2,000 peripheral facial nerve palsy patients. Okay, out of these 2,500, 1,001 patients had a diagnosed with Bell's palsy. And as you can see, 70% of them had a complete paralysis, while 30% of them, 512 patients, had incomplete paralysis. So the patient who had incomplete paralysis, the majority of them, 94% of them, fully recovered without any medical intervention. However, patients with complete paralysis, the 70% of them, only 61%, 721 patients out of them were fully recovered. Okay, so if it's a complete paralysis, the prognosis of the disease is totally different. In figure 5, we can see the distribution of time for complete paralysis. So some of the patients were fully covered, 12%, after several weeks, while after 2 months, 58 of the patients were fully recovered. In terms of this figure 6, we can see the cumulative recovery. So after 3 months, 64% of the patients were fully recovered, and after 6 months, 71% of the patients were achieved normal facial expressions. So basically, we can understand from this figure that after 3 months, the possibility for normalization is very small, because from 3 months, only 64% to 6 months, 71%, only 7% of the patients were fully recovered. So 3 to 6 months considered to be already a chronic stage of this disease. In terms of the treatment, basically the goal of either Western medicine treatment or Chinese medicine treatment, especially in the acute condition, is to prevent any complication of the corneal and due to the difficulty to close the eye. We want to eliminate any discomfort, any pain, and to speed recovery. So the standard medical treatment in the acute stage is pharmacological one. Usually corticosteroids are being used together with antiviral agents due to the fact that HCV type 1 is being associated with this disease. The non-pharmacological treatment include facial massage, physical therapy, acupuncture, and other complementary medicine treatments. Patients are being treated for eye care, protecting the cornea from drying, all kinds of lubricating drops or eye covers. Some approaches, for example, in Taiwan, they supplement the patient with vitamin B12 either in oral take or in injections because of the association of vitamin B12 for the nerves, the beneficial effect of this vitamin for the nervous system. And last, if we have severe chronic conditions, so surgical options or other invasive treatments like Botox injections are being offered for persistent severe cases of palsy. So this figure is coming from a very large scale study, which was published in Lancet, one of the highest impact factor journal in the world. So it's a very good study, considered to be a very good study. It is a randomized, double-blind, placebo-controlled. Okay, basically this study was done in one of the Scandinavian countries again, and 829 patients were included. They had acute Bell's palsy, and they were randomized into 4 groups. Okay, so the 4 groups were a placebo plus placebo pill. This was the first group. The second group was steroids plus placebo pill. The third group was antiviral agents plus placebo. And the last one was steroids plus antiviral agents. Okay, so they follow the patient for 12 months. So in these cases, you can see the time of follow-up calculated in days. Okay, so what's quite interesting about this study is that, first of all, this study showed clearly that the role of steroids, so this group is steroids with placebo, and this group is steroid with antiviral drugs, as compared to placebo or only antiviral drugs plus placebo. So one very obvious conclusion from this study that antiviral agents doesn't have any role and do not support the recovery for Bell's palsy patients. But what's interesting about this figure is that after 100 days, more than 3 months, the patients were not fully recovered. So here, this ACID is complete recovery calculated by Sunnybrook scale. It's one of the facial nerve grading scale. So basically, from doing a clinical trial, I have experience with this method of scaling the recovery. The physician is doing some kind of physical examination for the patient, and he evaluates them by giving them a score to each test that he's performing. He's asking them to do like this with the lips and so on. So if it's 100 points, it means they are 100% normal. However, after 3 months, you can see that the patient reached only to 60. Okay, and only after 400 days, more than a year, the patient reached to the score of almost 80. So from doing a clinical trial using the Sunnybrook scale, I can tell you that 60 to 70 is between moderate to moderate severe patients. So what I'm trying to say is that about 20 to 30% of these patients, they have complication, they have inadaptive recovery, okay? And as consequences to that, these patients are suffering from hemifacial spasm, facial weakness, and voluntary or involuntary contractions of the facial muscles. Due to that, they have physical and social impairments, and the medical option for this chronic condition is quite limited. Besides surgery, which is very, there is no evidence to support that surgical interventions are useful for these patients. Basically, there aren't many medical options for them.